Hi, I'm Marie from Switch on Health, and today I'm going to discuss the homeopathic remedy Arsenicum album, which is from arsenic. So this will be acute or chronic presentation. So it's just to understand the kind of basic picture that Arsenicum album has. So we know that it's made from arsenic. We also know that it's a poison. It's been used for a really, really long time in medicine industries. We know it's a poison. We know it's used today as a poison. Um, it's used for, you know, things like timber, stopping it to decay, strengthen alloys, metals. So there have been a huge amount of uses for this poisoning, and it is highly toxic. So it's a really good example of Hahnemann taking a poisonous substance and diluting it and shaking it, which is potentizing it, till there aren't any more toxic elements within the homeopathic remedy. So, but at the same time, because it's done in water, that water preserves those healing properties. So we'll still see the same picture, but it's harmless. It's not toxic to actually take. So arsenic has a really good doctrine of signatures, which is used in our Materia Medica as information about the remedy. So, I mean, it's a poison. And we can see that there's severe abdominal pain, there's burning, there's cramping, there's vomiting, profuse watery diarrhea. So there's a lot of symptoms here that are really the same or similar, very similar to actually being poisoned by arsenic. So these poisonings have been around. So it's a really good example of just how you will see this doctrine of signatures very similar to the homeopathic remedy that we use in clinic. Right, so the main indications for Arsenicum album is prescribed for individuals showing traits of anxiety, meticulousness, they're fastidious, they're careful, they're cautious, and this strong need for control, which brings about this cautiousness. So what happens there is a lot of fears, right? There's a fear of being alone, being left alone, being abandoned. There's fear of disease, cancer, heart disease, dying. They might, just feel like they're being poisoned. They feel that they're kind of being attacked, that they're not safe. So hence they're really frightened easily. So what brings this about is a lot of anxiety. So the anxiety at night, alone in bed, they have to get out, they wake up with anxiety, they can have it anxious during a chill, during a fever. They have a lot of anxiety about their own health, whether they're going to survive. And this can happen, on waking, that they feel there is this kind of deep level of anxiety. This brings in this restlessness. So we can see from the anxiety that the mind is going to be restless. There's going to be overthinking, keep going over and over and over things. The restlessness will be in their extremities. They will have to get up, they'll have to move, they'll have to walk, they can't sit still. You can observe possibly a patient in the clinic and they'll be kind of moving about, just a little bit restless. They're not happy just to sit still. They might get up, they might look at their phone. So these observations are really important. And their sleep is restless. Always ask someone about their sleep. They will be continually tossing and turning. It's a very restless sleep. They don't feel like they've had a good night's deep sleep. And so from all of these fears and anxiety and restlessness, there becomes this weakness. And the weakness is expressed in the mental symptoms, in the memory. They've got weak memory, they feel weak, they feel very weak during a fever. You know, there's lots of internal organs they might have with the bladder, incontinence. So there again is all this weakness. So it can be expressed in quite a few symptoms, physical and emotional. It's up to you to sort of put this together. The main kind of physical symptom, and there are a lot, but burning pains is a really big keynote. All right, there are discharges and it feels burning. And this burning can be felt in, you know, the stomach or the skin, in external organs, internal organs. So just kind of really go through and find out when the person is in pain, what kind of pain it is. Is it a burning pain? Is it aching? Is it stabbing? Is it wandering? All of these are going to give you a clue when the patient can describe their pain. Sometimes that's difficult for patients to do, but it's best not to prompt them. You need to get that from them because sometimes they will just kind of grab at what you say. All right, so these are the mental symptoms. So you can see this is what's in Arsenicum album. This is in our Materia Medicas. It's in our repertory. There is this intense anxiety and restlessness. They can't remain still despite feeling really weak because they're really weak within themselves. They feel weak. They feel old. They feel defenseless. So there's a fear of death. And so then that's when they're alone or they're going on bed. So they need company. They need to feel that someone is there, that they can be looked after, that they're not forsaken, that someone is there for them. So there's a sense of hopelessness. In the periodic table, which Jan Scholten has done, Arsenicum sits quite towards the right and the end of that fourth row. And it kind of means that there's just that hopelessness is there. They haven't completely lost hope because they will be doing things with their restlessness, with their concern for health. You know, they will be taking lots of vitamins, supplements. They'll be looking exactly what they want to eat. They like to walk, they like to exercise. So everything is kind of very controlled, trying to maintain some strength, even though they feel really weak. So when I say that fastidious is there, it's orderly. So they will be quite fastidious about cleanliness. They want that order. They're trying to maintain that control. Often this remedy is put into the cancer myosome, that being the underlying state. So, so there's anguish, obviously, from the anxiety. There's despair. There's despair about their health, how they are. They want company. They need company. They need that support. Yet they're very distrustful of others. They're suspicious. They might think that they might take their money. They might do something to them. But at the same time, they really need that support of other people because this inane weakness that is there. So they're critical of others. They're very judgmental, but also too critical of themselves because if they're critical of others, they're going to be critical of themselves. The mind is really active and the body is weak. So this mental restlessness exceeds that physical capacity. They lose that. And so everything just goes round and round and round. And so the anxiety can occur anytime and they can be generally anxious, but after midnight, they can get up out of bed. They have to walk, they have to move around, they're not comfortable, they might have to get up, drink, make a cup of tea, do something, and then, you know, they might be able to go back, but again, they're restless, they're moving around. All right, so the physical symptoms, which I mentioned briefly in the last couple of slides, the burning pains, as if it's from hot coals. So this is interesting that it's relieved by heat, not by cold. Everyone thinks, oh, something's hot. If you burnt yourself to put cold water or something on it. Yes, it sometimes does that. So if there are a lot of remedies that have burning pains. Apis is a good example. It has that burning, but it's relieved by cold applications. So you have to be mindful to say, okay, what helps with this pain, whatever they're experiencing, what makes it feel better? And so you're looking for, maybe being relieved by heat, and that is an indication for arsenicum. So there's burning skin eruptions. Again, hot applications will help that. What they're thirsty, they're dry, but they don't want to drink a lot of water. Like phosphorus will gulp it down. Aconite will be really thirsty again, and they'll drink large quantities, uh, and they'll want a cool or cold water or ice water. But arsenicum just wants to sip. And they can have a large quantity, but they will have it over a very period of time. So it'll be a warm drink that they will prefer, or maybe even tepid water, but definitely not cold, because the cold water is really not good for their stomach. It kind of makes them feel unwell. It really can aggravate the symptoms. And so that you will know that they don't want to do it. And you can ask them that question, do you prefer tepid, cold, warm water, tea? What do you like to drink? So they can't bear the sight or smell of food, even thinking of it nauseates. There, again, that extreme weakness is really out of proportion to what's happening with the illness. They just want to move, but they can't. They feel like they're going to die. You're seeing this quite weak physical symptom, but also to that mental aspect, because it all comes together. Their discharges are, really offensive. Anything like the vomiting, stools, even ulcers, things like that. Anything that there is a discharge, it really has a really peculiar, what's the word? But anyway, a really peculiar smell. Right, symptoms are worse after midnight, especially around to 2 a.m. So, I mean, this can also indicate aconite. So you have to differentiate, because aconite will come on suddenly. But again, they're full of fear, but more fearful. So that is a kind of differentiation that you can make and say, okay, they're restless, things aren't good. So they're chilly. There's lots of remedies that are really chilly, and they want warmth in every form. So that's when I said before, they really like warm tea, warm drinks. They want to be covered. They prefer warm food. They don't like raw food or cold food. They don't like a draft or being outside. They just want to remain warm. And so, in some respects, it's a little bit like the mental symptoms. They're kind of trying to contain themselves, right? Due to this weakness, they're being cautious. They're trying to look after this themselves. And this is going to kind of alternate with collapse, and then they can be irritable. They want help, but they reject it. They don't trust people, but they need it. So it kind of goes back and forth with those kind of main physical symptoms that you can look for. So the modalities, so they're better for warmth, hot drinks, being covered, company. I mean, even interestingly enough, that they want that company, it's kind of warmth from that company, from being with someone. So I think it kind of extends a little bit further than just the warm drinks, and warm food, all of those sort of things that they like. Coffee ameliorates, so coffee can make them feel better. They're worse after midnight, so again, look at when they are worse. They may have gone to bed are not feeling great, then waking up and they're worse after midnight. It might be different from aconite, who awake suddenly and they have a fever, and that has come on suddenly. They're worse for this cold, damp weather. So they're really, you can see how chilly they are. They don't want any more cold. Damp weather, wet weather, anything, any drafts, cold winds, they want to know about it. It really does make them, it does really aggravate their situation. Again, cold drinks or cold food on exertion. So even though they want to move around, it exhausts them. So there is this kind of thing that happens, and they're worse for being alone, but sometimes they want to reject that as well and don't want it. But they are worse for being alone. They need that company. And I think it has a lot to do with that fears. If you're here, I feel safer. I don't feel as weak. I have support. Right, so Arsenicum has a lot of delusions, so I've included this because they're peculiar, and you will see this. So the time has come to die, right? So they can say, okay, I know when I'm going to die. I think I'm going to die. I think I've been poisoned. I'm dying. And so this can even extend to their over care of their health and that fastidiousness and being very meticulous about what they eat, how they exercise. Some won't even go to a restaurant because it's not the right food. It feels like it's not good for them. They have to be very careful. They have to be very cautious. They have to really look after themselves. So this is where the delusion that the policeman is coming into the house. He's pursued by police. So it's a kind of weird delusion, but it means that they're not safe. They don't feel happy on their own. They feel weak. They see ghosts and spirits day and night. So question them. How is the ghost? Are they happy? Are they going to get you? Again, it'll be that fear, that anxiety, that something is there, something they can't control, because a lot of it is all about control and being careful, being cautious. He's falling out of bed, the bed is tipping over, someone is under the bed. So they feel like they just don't have that control. They're going to fall out of bed. It's like they're going to die. They can't control this. They're on their own, and then someone is there to get them. I mean, they will be very protective about their money. They think that they need these people, but I have to be very cautious because they could take my money. They could take something away from me, and then I will be lost. I could die. So again, the same thing comes in with the thieves are in the house. Someone's going to take something from me, right? Under the bed, they see thieves. And it's not see thieves at night, but the delusion, but that it can extend to this person is trying to do this to me. They're trying to take this from me. So he sees in his bed that is covered with bugs crawling all over the bed. Worms are in the bed. Now, my son, when he was about 5 or 6, and I wasn't doing a lot of homeopathy then, he woke, he had a fever, and he was literally sitting in the bed saying, there are bugs, there are ants or some kind of insect, I can't remember, crawling all over me. So you'll see this, right? It was a delusion. That's what he was seeing. I don't think at the time I gave him arsenicum, but I probably would have given him something else in my first aid kit. And yes, talking about first aid kits, arsenicum is probably the first one that you will always have in there. If you make up a first aid kit for anyone, it's a really excellent remedy, always have on hand. The same if you're doing a travel kit, especially if someone is traveling to Asia, where the water is different, there is a high likelihood of getting some sort of gastrointestinal complaint. Right. So sees rats, insects running across the room. and that he has offended people. So this again goes back to wanting this company, needing these people. So there is a fear or a delusion that he may have offended someone and they're going to forsake him. They're going to leave him. They're not going to be there for him. So, and for that protection that he feels he needs. All right, so I'm just going to go through some acute conditions where you can use arsenicum. It's a fantastic remedy for diarrhea or food poisoning. So these are just the examples of what you might look for in the diarrhea that they get. You know, it's kind of thin, it's offensive, but yeah, lots of stools are offensive when you have diarrhea, and it's accompanied by vomiting. So you have these two things that are happening, and there's violent pain in the stomach or the abdomen. It feels burning. They're pale, they're weak, they're cold, and they have a dry tongue. So the dry tongue means that, you know, that it feels dry, but they will just be sipping water. They won't be gulping down water or anything like that. And of course, you just see this emotional restlessness or physical restlessness. Restless still can be bloody, watery, mucus, and dark. It can even have that rice water consistency that was talked about in the poisoning. And so these are possibly some remedies that you may want to compare. Bryonia, but again, remember, I think I have spoken about Bryonia before, not in this slide, but Bryonia wants to lie still. It's a very dry remedy and they're better for no motion. So you know that's not an arsenicum picture. If they're walking, they're restless, all of that sort of thing, then bryonia is not really going to suit. Pulsatilla can be well indicated, but again, you're going to be looking at a different emotional symptom. They want company. Everything is changing. Pulsatilla, everything changes. The pains wander around, they change. Everything is different all the time. Yes, it is well known for being, has the affinity for the digestive system. Podophyllum can be given. It's one where there is a really yellow stool, it's watery, it's explosive, right? It's gushing, it's out. They have that weakness. There is an interesting symptom. They can feel dizzy after they've had their stool. But then, you know, every remedy has its kind of quirks and different ways of expressing what might need to be given. So, food poisoning, big one again. I've given this so many times. Nausea and vomiting, restlessness. There are violent abdominal pains, right? It's really severe. Burning in the stomach. Again, that burning symptom. They want to crave ice water, but which is interesting because they don't usually like it, but it doesn't agree with them. They will vomit it. And this is interesting because often I will use phosphorus of veratrum alp for someone who has water, cold water, phosphor cold water, and when it hits the stomach and becomes warm, they throw it back up again. And so Phos and Veratrum album are really good remedies for that because they just cannot tolerate that in their stomach. So they will be drinking frequently and sipping only. So the problem is with, say, phosphorus is they're going to gulp that water down. Obviously worse after spoiled food, and that's where you're going to be thinking about something. And nux vomica is also well known for anything that's overindulgent, all of those sort of things. Oh, I forgot to mention with pulsatilla, they may have possibly got the diarrhea from too much rich food. Even though they can desire that, it doesn't sit well with them and their digestive system. So, you know, nux is another one to consider. So look at why they have the food poisoning. Was it overindulgence? And nux, you know, whether they're really irritable, angry. So take the other symptoms to see whether it is arsenicum or nux vomica picture. Now, carboveg I mentioned here because it will have that diarrhea. It will be from food poisoning. There's a lot of rumbling, there's a lot of gas, there's a lot of noise happening. And carboveg is like a completely collapsed state. It's known as the corpse reviver. It really is so exhausted. So it's the next extreme from Arsenicum, where they really can't get up. They're absolutely kind of like on death's door. So for the nausea and vomiting, again, we're talking about this, there will be this weakness and the burning. So you can see the same kind of things, even if the nausea is still there. They'll have an odd symptom like their coldness of hands and feet. So there can be little things that will help you differentiate whether you need to give arsenicum or not. Sort of vomiting with diarrhea, and again, the worst, spoiled food, bad meat, water. And you know what happens to a lot of us if we actually, go to Asia. The water is different, might have been washed in some water that's not got that our systems are basically not used to. All right, so you can compare Epicac or Ant Crude. I've talked a little bit about phosphorus or veratrum. So again, with phosphorus and veratrum, if you see, that instant vomiting after drinking or having anything, then consider those two remedies. Yeah, it's important. Epicac, they'll vomit after eating, right? So eating doesn't really agree with them at all. Yes, so you can just look up those symptoms. Now, with the flu, because I'll talk about flu and colds, really important to differentiate exactly what the patient has. Do they have flu or do they have a cold? Everyone will kind of say when they've got a cold, oh my God, I have the flu. It's a fairly standard kind of comment these days, but people don't really understand the difference. So make sure when you're in clinic that you do know the difference between flu and the cold. So influenza with arsenicum, again, restlessness, great weakness, burning, coldness in the chest. Then when they really, really can't, do much, but they're still restless. Even if they can't get out of bed with the flu, they're going to be tossing and turning. They're just not going to be able to be comfortable. They will have chest difficulties and breathing. There'll be shortness of breath. And there's kind of little expectoration that comes up. So they're not able to get anything off their chest if they need to. And again, this is part of this weakness that exists in the arsenicum state. And they can be a little bit frothy. There is copious discharge from the nose. Yes, and they're usually generally better kind of sitting up. That helps with their breathing, their chest difficulties. Just sitting up, being able to take that more air, and the copious discharge from the nose. So the nose is really, really running, and sometimes that can cause burning around the nostril areas. So the common cold. So arsenicum's used in this kind of second stage of the cold. Their nose is running, watery discharge. They might have that burning again or excoriation that can occur here. The mouth is dry, they're thirsty. It's blocked and it's worse at night. So again, lots of things are worse at night. So just kind of remember that, but obviously not the only remedy. But it will run during the day. So there's been that release where they're able to, walk around, and that walking around helps better. So I think, that helps that watery discharge and that release where they're kind of trying to lie still, they're worse. This is when you find them that they want to maybe sit up in bed because of that blocked nose. They're irritable, again, chilly, restless. Again, bryonia you might want to consider. Again, they're very dry, they're very thirsty, they'll drink a lot of water. Aconite, again, that sudden fear, and it can be possibly one that you might want to consider initially. Pulsatilla, It's going to be used maybe also in the second stage of a cold, but the discharges will be greenish yellow, thick. Their pains are going to be, or their symptoms are going to be constantly changing, like pulsatilla. So you just kind of need to look at those, how they present their symptoms. If in a fever, they're restless, they're agitated, again, feeling weak. So you're starting to see all these symptoms in any kind of acute situation or even chronic. They're going to display these same symptoms. These small amounts of water, sipping only, and again, worse after midnight. Yeah, I forgot to mention that recently, just with a young girl, her mother rang me. She had a fever and she literally thought she was going to die. She thought she said, my daughter thinks she's going to die. The fever wasn't even that high. It might have been maybe 38 and a half or something, but this is what she felt. So it was very much an arsenicum state where she thinks that. Aconite can also think that. So that's when you need to really differentiate those modalities and see whether it might be aconite or it might be arsenicum. I mean, belladonna is going to be thirstless with a fever. They can have delusions as well, but those are the kind of differentiations. They'll be hot, they'll be dry, but they're thirstless. Gelsemium is also thirstless. So, but they're kind of trembling. It's a different state. And again, bryonia. So I've talked about bryonia before, so I probably don't need to mention those kind of similar symptoms. And you can read a lot more about bryonia. And when you're obviously making these decisions as to which remedy you might consider, then that's when you kind of need to read more about the state of each remedy and what comes up maybe in your repertorisation that you've done. All right, so what I'm going to do is I'm just going to present this is a Arsenicum case. So it was an acute case I took. This female was 14 years of age. So her mother rang me and she had vomited once, but she felt better for vomiting. But then there was cramping, and that was still better for vomiting, but she'd vomited a lot more. She had a temperature. There was a lot of retching, a lot of gagging, and she had, consistent nausea. So even the vomiting wasn't helping with the nausea. There was cramping. She said it was really bad. It was difficult to walk, but obviously maybe she wanted to walk, and she was better for double or forward bending. So that was kind of ameliorating. So often you can ask, what makes the person feel better? What are they doing? How are they responding? What are the observations? So you can ask the mother that, because if a mother phones about her child, she's just going to say, oh, they're vomiting. They're not drinking. They don't have any appetite. But that's not going to really help you, right? There's no clues there as to really what remedy to give. I mean, and most likely it will be very strange if they did want to eat and drink and felt okay. So, they're kind of normal symptoms, and you need to look for these individual symptoms, these symptoms that, are expressed by the patient, right? So she said she's kind of drinking. So here we have that sipping, the small amounts. She wants lemonade. She wants just a little bit of it. She wants to drink. She's thirsty, but she's just sipping. So even in the case of a fever, especially with babies, you have to be very careful that dehydration doesn't occur. So the sipping of water is really good. That's going to keep them hydrated. If you have a case, like I mentioned before, say with phosphorus, and as soon as they drink something and it's thrown up, then that can quickly turn into dehydration. Obviously more so in a baby or an infant, but again, also too in an adult. So be careful of that dehydration. I often suggest that if a person can't drink or doesn't want to drink, then they can have ice. So they're just having that slowly into their system if that's what they want. Um, I had my son, he was about 12 months old, many, many years ago. Every time he went to drink, he was thirsty, he would throw it up. So what I did is that I got a bowl of water and I gave him a teaspoon. And he wasn't very proficient with the teaspoon, which was good. So he just kept doing this and just getting that water into him. And he actually didn't dehydrate. I did take him to the doctor a couple of days later. He was still unwell, but he wasn't dehydrated at all. So think of these little things just to make sure that a person doesn't dehydrate, right? So this female, back to the case, she was restless, she was moving around. Again, that restlessness, you can't just lie still. You think, if you're unwell, why wouldn't you want to just lie and go to sleep? But they're not. So stool is watery, it's yellow in colour. So that's the kind, they have this diarrhea. She had diarrhea. So she was eating okay, but she was worse after eating. So look at that. Even that symptom alone, are they better after eating? Are they worse after eating? Are they better after drinking? Are they worse? Are they hungry? Do they have no appetite? So she was hungry. So the fever was around about 38.7. Parents panic, usually above 37.5, which is a shame because the fever is the first line of defense for the body. It's going to kind of start to burn up whatever the virus is or bacteria. So it's there serving a huge purpose. So I'm not one for giving anything to lower the fever. I don't think it's a really good idea. I often educate and have over the years saying the fever's okay, it's fine, it's your friends. I mean, even the medical establishment now acknowledges that, which is really good. She did take the girl to the GP and said it was viral. She wasn't sleeping, she was waking every couple of hours. Again, that whole restlessness, and she was clingy. So it was kind of like she wanted someone there. She'd had gastro complaints before. So it's kind of a susceptibility for her. So this cramping is worse this year on and off. And the only emotional symptom was that she was anxious. I couldn't get much more. Often with acute cases, sometimes you can't get many symptoms, but if you can get something, at least I had the anxiety to work with, although anxiety is a big, big symptom, and many, many remedies have that in them. Anyway, so what I did is that I prescribed Arsenicum 30C. I did suggest to the mother to get 200C just in case that potency at 30C wasn't going to work. So I said repeat 4 times after each vomiting episode. And if there isn't any change, and I usually only leave 4, some people say 6. I go, okay, if there's nothing happened between after 4 doses, then switch to a higher potency if you feel the remedy is really well indicated, which I did feel at the time. So this vomiting and food poisoning and diarrhea in this case is a perfect example of how to take the remedy and when to repeat. Everyone says, oh, should I repeat it every 15 minutes or in an hour? So there isn't anything mechanical with homeopathic dosing that I do in my clinic. It's the same as that you've taken the physical symptoms, so the body's given you all those physical symptoms, and now what you do need to do is for them to take a dose and see what happens. So again, the body's going to respond or not respond. So this is going to let you know when you need to repeat. So the body's going to indicate that. I can't guess when someone is going to need another repetition of, in 15 minutes time, something like that. So vomiting and diarrhea is a really good example. So that's what I said to the mother, repeat the dose after the vomiting episode. So you can do this for diarrhea. You can do this if they wake in the middle of the night with a fever. They don't go back to sleep. But I think, vomiting and diarrhea is really good because you can tell. So when they vomit, right, they repeat the remedy. Then if there is less frequency of the vomiting, if it's less violent, if you can see those changes that they're improving, if they don't vomit again, you can leave it. But if they vomit again, then that's when you repeat. But of course, if they've repeated, 4 times, and maybe I said, look, just after each vomiting episode, you're not sure. It is a little bit difficult to explain. But anyway, basically what happened is that Arsenicum 30C worked. She didn't need to take the 200 and the vomiting stopped. So this is the rubrics or symptoms that I took. So this is from particular repertory. So the repertories differ. Symptoms can be very similar, but different repertories have different structures. So sometimes they have different wording of the rubric. They might have them in a different chapter. That whole structure might differ. So I've used, just to let you know, I've used Adonis, which is in Radar Opus. So that's the main repertory that I use. Do use other repertories. So these are the symptoms that I put in for this case. So I thought I'd just give you an idea just as to what I used. And you can see that it didn't cover all the symptoms. Bending double ameliorate, that wasn't in Arsenicum. Again, that abdominal pain, bending forward, the cramping, that wasn't there. Other remedies were indicated. You can see that there was Arsenicum that came up first, then Pulsatilla, then Nux vomica, then Ipecac, Bryonia, Phos. So you can see the usual suspects and things that I talked about. Anyway, I just thought I'd give you just a look at that and how to put symptoms on a clipboard and come up with an analysis. The colors there are just different gradings for the remedies. You will learn that in another subject with homeopathy. All right, so the key rubrics most indicated are this anguish and the anxiety. So you can see there's 852 other remedies, but Arsenicum is one of the most highly indicated remedies. So it's something that you can think about. So that's again for this conscientiousness about trifles, which is really being meticulous, being fastidious, having over concerns, over worrying about very small details, things that might affect them. Right? So again, that fear of death, which we talked about, that they're going to die, the fear of robbers. So someone's going to take something from them, right? They're not safe. They're not safe at all. And then there is an element of greed, of avarice that's there. And that comes with that fear of things being taken away from them. Do I have enough? Do I ever have enough? So there's an element of there that which, a patient might talk about. And there's sadness of being alone. They feel, before when I said that they've offended someone, they've been left alone, they've been forsaken, they're on their own, they feel weak. So what I've done here is that I've just listed some rubrics. Now these rubrics are again from that same repertory, so you might find different wording, but I just thought that this might be helpful. These are the only remedies or only rubrics or symptoms that are indicated for Arsenicum. So there's nothing else, right? So that sudden fear at midnight or after midnight, Arsenicum, the restlessness, which will be alternating with that unconsciousness during a fever. They can have the head pain. The pressure on the abdomen causes that headache to sort of come on. Again, that you see the burning, it's above the eyes and the forehead, and it's at night time. So again, so I won't go through all of these symptoms. It's interesting they have false face and ulcers, which is kind of like wart-like. So there's some odd things there, and that's where only arsenicum has come up in the remedy. All right. Okay, so that's Arsenicum out. That's a picture of the remedy, and I hope you all have a great day. Okay, bye.